Today I am going to discuss about school health program. Development of children and the quality of their learning depends on a number of factors, including their own health status. Health promoting behavior inculcated by the school not only contributes in physical development and health care of students. Its spin-off improves awareness about health issues among the parents and local community as well. Strong relationship between health of students and their learning had inspired planners and educators 200 years ago in developed countries to launch health-related interventions in schools. Gradually developing countries are also realizing the importance of school health programs for quality education and overall health of the society, and are introducing its various components in their education systems. Improving the health conditions and process of learning among school children through school-based health and nutrition programs is not a new concept. At present, most of the developed countries have institutionalized school health programs as an integral part of their education system. A number of national and international agencies have decades of experience in the area. School health programs are primarily based on two pertinent premises. Firstly, the relationship of quality of learning with the health conditions of students, and secondly, responsibility of the state to facilitate smooth physical and mental growth of children for their future role as productive member of the society. A third dimension emphasized in certain situations is the potential contribution of students in dissemination of health and hygiene education messages to their parents and community at large. This phenomenon is also termed as child-to-child and child-to-community transmission of information relating to healthcare and disease control. Global experiences link success in school health program with partnership between various departments and agencies, including education, health, and environment. Partnership and networking between relevant departments and agencies provide an opportunity for concerted actions to broaden the scope of school health programs and make them more effective and beneficial for the target groups. Effective school health programs will transform school into child-friendly environment and contribute significantly to the promotion of education for all. To think why school health programs? Education sector not only trains or prepares the human resources needed for the economy, it also produces the leadership for various spheres of life. The leadership coming out of the educational institutions influences the social and political dynamics in the country. Teachers, professors, and education managers enjoy respect in the community, and they have the potential to contribute significantly as catalyst of social change and development. According to the latest statistics issued, over 34 million children and young people of age 5 to 24 are enrolled in 228,304 educational institutions in Pakistan. Health sectors cannot afford to ignore this large group of 34 million students and 1.28 million teachers in Pakistan. There is a need to reach out this important population group, the future builders of Pakistan. Health School health programs will yield following benefits to the country: reduction in dropout rate, enhancement of quality of education and learning outcomes, improvement in health conditions of young population, disease control, and an overall improvement in health conditions in the society at large. There is an urgent need to plan and launch a comprehensive school health program under the auspices and partnership of Ministries of Health, Environment and Education, and with the technical support from various United Nations agencies and other donors and professional organizations. A number of factors influence the physical and mental health of school children and their learning process. These factors include health conditions of the children themselves, physical and social environment in their school, quality of life of their parents, their own knowledge about health promoting practices, and availability of health services around them. Modalities and delivery forms of school health related interventions can be grouped into following categories. Number one is school health environment. Second is school health education. Third one is school health service, and fourth one is the school nutrition program. School environment plays a pivotal role in the retention and learning outcomes of students. Availability of proper facilities is a prerequisite for creating a healthy environment in a school. Provision of facilities contributes in creating a conducive environment for the children in the school. Safe, clean drinking water with regular water quality monitoring. Gender and culturally appropriate sanitation and toilet facilities. Adequate spacious classrooms, comfortable seating arrangements, playgroups, a child-friendly environment, access for disabled and physical challenged. In the absence of these all facilities, overall health and mental concentration of the students will be negatively affected. Many children are likely to leave the school due to its uncomfortable and unattractive environment. Safe drinking water is essential for the health of children. To improve school environment, UNICEF is building toilets and installing the water pumps in school. Young children are at a greater risk of various infections and diseases. Schools have the responsibility to educate their students and foster among them healthy and hygienic behavior. They need to warn their students about various health risks and guide them how to protect themselves and others against diseases and other forms of ill health by adopting health and hygiene promoting habits and practices. Education of students on health and hygiene issues through integration of health and hygiene information messages into the curriculum, and training of teachers on following themes form part of the school health programs. Education about cleanliness, personal hygiene and sanitation. Preventive information against various non-communicable common diseases. Prevention against communicable diseases including H1N1 and hepatitis, HIV and AIDS prevention education, guidance and counseling for adolescent students on puberty issues, anti-drugs and anti-tobacco education, healthy foods which include the balanced diet and clean drinking water, sports and physical education, population education and adolescent education, environment education, life skills based education, orientation of teachers and PTAs SMCs to stop corporal punishment in schools, provision of information, knowledge and skills to the children, enable them to develop healthy behavior and protect themselves from diseases and practices which can make them vulnerable to various hazards in their life. Young children are prone to many diseases. In the developing countries where health services for the general public are poor and overall knowledge about healthcare is low, parents and teachers are unable to detect health problems of children which impede their learning as well. Provision of health services to the children and young students fall under some categories which include health screening, medical checkup of students on regular basis, referral of students with health problems to medical centers for treatment or rehabilitation, deworming campaigns. Children are always being examined to detect any sickness or health deficiency in a school. Timely diagnosis of ailments and health defects among the children enables the school or parents to take corrective measures. A number of children can be saved from losing interest in their studies and dropping out of school when their learning difficulties or disorders are detected through health screening and addressed at any stage. Collaboration between health and educational sector is crucial for this component of school health program. During the health screening, the eyesight of the school children being examined and tested by the health officials and children. Nutritional level affects overall health and consequently the pace of learning among the children. In Pakistan, a substantial ratio of children is malnourished, particularly in underdeveloped areas and among the disadvantaged groups. Nutritional inputs can increase both attendance and quality of education. Provision of following inputs to school can be grouped under nutrition component of school health programs, which includes good supplements for malnourished children, food as incentive to enhance enrollment and attendance, promotion of use of iodized salt, school feeding or school lunch programs for all students in school. World food programs provide the food incentives in selected schools to improve girls' enrollment and retention. In the developed countries, school lunch or school feeding programs are widely supported. In a number of neighboring countries, School feeding programs are being implemented. Pakistan had launched this program in the past and its result was encouraging. It was stopped mainly due to the mismanagement. School health program has been institutionalized in most of the developed countries. In the recent past, a number of developing countries have also come forward to launch some form of health related interventions for their schools. Iran, Ministry of Health and Medical Education, in collaboration with Ministry of Education and Training, has launched National Integrated School Health Screening Program in Iran. This program aims to identify children who have early signs of health programs and health problems. For example, during 2007 to 8, screening of 3.1 million students was completed. Out of these, 12.48 had weight disorders, 4.77% had visual disorders, 3.95 had head lice, 2.24 had behavioral disorders, and 0.6 had hearing disorders. Students with health problems are referred to outpatient clinics or hospitals, and all services are offered free of charges. Cherish in Singapore. The Cherish, which is the championing efforts resulting in improved school health, award was launched in August 2000 to give recognition to and encourage the schools to establish comprehensive health promotion programs for students and staff through the fostering of good physical, social, and emotional health for optimal learning. The Cherish Award provides a framework for establishing comprehensive health promotion programs in the school, modeled following the recommendations of the World Health Programme's Health Promoting School Initiative. It uses a whole school approach towards health promotion. The Health Promotion Board introduced the School Health Promotion grant in 2003 to encourage more schools to establish comprehensive school health promotion programs. The grant can be used to partially fund healthy promotions programs targeted at students or staffs in school. HPB will reimburse the school 50% of the total amount spent by the school for health promotion activities, up to a maximum of $5,000. Schools must co-fund the project by contributing an equal or higher amount. Fit for School program in Philippines is third example since 2003. Fit for School program is being implemented in Philippines. Interventions at school level include daily supervised hand washing with soap prior to recess, daily supervised toothbrushing with fluoride toothpaste, and biannual deworming of all children. The costs are comparatively low, but benefits are high selected evaluation of the program have confirmed following impact. Infectious diseases include diarrhea and respiratory infections are reduced by 30 to 50%. The progression of dental caries is reduced by 40 to 50%. The prevalence of parasitic worm infections sinks by 80%. The number of children with below normal height and weight is reduced by 20%. School attendance raises by 20 to 25%. Currently, the program is implemented by Philippines Department of Education in close cooperation with 20 different units of local government. The Department of Education has also launched a new school health program which seeks to address both malnutrition and academic performance of elementary schools in selected schools nationwide. Program is focusing on preschool and grades 1 pupils. Each recipient child is given a ration of 1 kilo of rice on each school day. In 2007, million children, about 2.7 million children, were benefiting from this program. National Rural Health Mission, Ministry of Health, in collaboration with education sector and states, has launched a school health program, which is nationwide, is comprehensive in its scope and nationwide in its coverage. It intends to cover 1.288 million schools, benefiting 220 million school children. SHP in India consists of following components and interventions: health screening and remedial measures. At least annual health screening covering general health and personal hygiene, clinical assessment of anemia, eye examination, eye discharge and hearing problems, common dental conditions, common skin diseases and infestations, heart defects, disabilities, learning disorders. Remedial measures include remedial actions at school level and referral to the laboratories and hospitals. Students' health cards and transport facility for referral are provided. For documentation purposes, school health register is maintained. Bigger schools are provided necessary equipment by the health department for health screening. Second component is health and nutrition education. Health and nutrition education messages are transmitted using multiple approaches, including infusion into curriculum, extracurriculum activities, physical education and supports, and health counseling. Third component is nutritional intervention, which includes an important component of nutritional interventions in midday meal program. This program has led to improvement in enrollment, retention, and learning achievement. Second intervention is provision of micronutrients, including weekly provision of iron, folate tablets, and administration of vitamin A in needy cases. Deworming interventions as provided as per national guidelines with biannually supervised schedule. Siblings of students are also covered. Fourth component was safe and supportive environment in school. Under this component, provision of sanitary facilities in schools are ensured. This means schools must be able to provide sanitary environment, functionally sanitary latrines, facilities for hand washing, supply of potable water. Fifth component was capacity building for health screening. This include training of health department staff to be involved in health screening, training of nodal teachers, and provision of a toolkit to schools consisting of training and resource manuals, audio visual aids, and guidebooks. School health program is being implemented in most of the states in India. Framework and guidelines for school health program have been developed by central government, whereas implementation is undertaken by the states. For additional information, please must be visit for the web pages of the National Rural Health Programs of Ministry of Health and Family Welfare. In Asia, a large number of other countries, including Sri Lanka, Bangladesh, Thailand, and Malaysia, are implementing some components of school health program. Sri Lanka has school health and nutrition branch established as part of Ministry of Education. In Malaysia, school health program is implementing through health promoting schools. In Pakistan, about one-third children under 5 years of age are underweight. 60% rural population does not have adequate facilities of sanitation and 23% people live below poverty line. Pakistan is spending nearly a small ratio of its GDP on health and education. Under these circumstances, there is a need to accord priority to health and education of new generations through school health program. More than 45% or above 50 million people in Pakistan are illiterate, mainly because basic education opportunities has not been made available by the state to all of its citizens. At present, about one-third children in school are not enrolled in primary schools. About 30 to 40% enrolled children leave the schools before completion of primary education and join the lot of illiterates in the country. Due to resources constraints, the government has been mainly focused on opening of new schools, appointing additional teachers, and provision of missing facilities in existing schools. Expansion of access to schooling, including construction of school buildings and the provision of missing facilities in the existing schools are certainly a priority. Latest statistics of EMIS reveal that most schools are sparsely equipped and lack basic facilities. This picture demonstrates the rooms per school in government primary school. This picture issued by Government of Pakistan, Ministry of Education, AEPAM, Pakistan Education Statistics. This picture shows that 70% primary schools in Pakistan have only 2 rooms, building for 5 classes. Many children in rural schools either sit in congested classrooms or study in open air. Inadequacy of space not only hinders learning achievements of students, it also negatively affects their health and physical growth at these early stages. This picture demonstrates that 61% of government primary schools lack drinking water and 56% do not have washrooms facilities. 33% government primary schools are without electricity. Many schools do not have boundary walls. Under these circumstances, not enough is being done to address quality aspects, particularly for the provision of required teaching environment and facilities to meet the developmental needs of young children. Various elements of school health program have been delivered in Pakistan in a fragmented manner. In the early 70s, school health services remained a component of health service. During the 1980s, some form of school health program was started, with focus on health screening, and medical doctors were specifically appointed for this purpose at the grassroots level. In most of the cases, medical doctors avoided going to rural areas, and an effective system of monitoring of their attendance could not be evolved. This initiative could not succeed in achieving the desired result as was discontinued. School health program was launched in Punjab by Punjab Health Sector Reforms Program and National Commission for Human Development. Summaries of their projects are given below. Punjab Health Sector Reforms Program perceived that there is a dire need of a health and nutrition program for the school children studying in rural areas. School health program was therefore designed and launched to improve health, nutrition and learning performance of students, to increase school enrollment, attendance, to introduce better hygiene practices in the community. School health program by PHSRP was conceived and initiated to achieve the Millennium Development Goals for health, education, and child protection. SHP in Punjab has following features and achievements. First one is appointments. School health and nutrition supervisors have been appointed at basic health unit level in 22 districts. Second feature was training and modules. Training material includes manual for SH&N supervisors and schools teachers on school health program has been prepared with the assistance of UNICEF. Training of SH&NH was another feature, which includes all the recruited SH&N supervisors have been given training in their roles and tasks. relating to school health program. Training of teacher was another feature. SH&N supervisors are also training school teachers in screening of common ailments of students relating to eye, ENT, dental, skin and general physical problems. Health screening was also an element. SH&N supervisors and teachers have started conducting health screenings in school. Referral and treatment was another feature which include after screening. If any problem is detected, the students are referred to health officers of concerned BHU. Health officers examine the referred students and provide treatment. In case the student needs any specialized treatment, health officers refers to the concerned specialty available at the nearest hospital. With a view to ensure coordination between health and education department, donors and implementation partners, Government of Pakistan has formed a steering committee on school health program. A working group on school health program has also been formed. School health program by PHSRP in Punjab is still at its early stages. At present, it is mainly focusing on one component, that is school health services. UNICEF is extending support in selected districts for improving school environment by constructing toilets and water pumps in school, promoting the hygiene education. It has supported testing water quality of about 46,000 schools. UNICEF is also supporting capacity building and involvement of school councils to facilitate implementation of school health program at grassroots levels. Punjab Education Sector Reforms Program is extending full support and cooperation to PHSRP for the success of school health program in the province. In June 2005, National Commission for Human Development launched school health program in 17 districts of Pakistan with funding from Bill and Melinda Gates Foundation. The program covered 23,266 primary schools of these districts and benefited 1.86 million students. These students were screened annually for health problems and were referred for corrective actions to the established referral outlets. For example, out of 1.86 million students screened during 2006 to 2007, 3.31% had weak eyesight, 1.31% had eye disease, 1.04% had weak hearing, 1.2% had ear disease, 5.02% suffered from dental problems, and 2.94% students suffered from skin problems. During this year, 53,543 students found with weak eyesight were provided free eyeglasses under the program. Gujarat Model of School Health Program in Punjab, coordinated by National Commission for Human Development, has earned appreciation of stakeholder. Some school program in Punjab is a laudable initiative. It does not include interventions relating to two other important components, particularly school nutritional support and a well-organized campaign on health education for students. There is a need to sustain and expand this good initiative in Punjab and replicate the same to other provinces as well. Pakistan needs a country-wide and comprehensive school health program which equally addresses all the four areas, including school health services, school health education, school health environment, and school nutritional support. And school healthy programs contribute in improving both health indicators among children as well as enhancing efficiency for the education system. Undernourishment due to poverty, illiteracy, and lack of awareness about health and nutritional aspects contribute towards deterioration of health conditions of the children from disadvantaged groups. In the absence of a comprehensive school health program, problems will continue to emerge, which include learning environment in school will not improve. Parents and teachers will not be aware of the prevalence of various ailments and disorders among the children, which affect their learning and can be treated at early stages. A number of children will face difficulty in their studies due to physical disorders and may leave the school without knowing nature of their health problem. A considerable proportion of children will remain malnourished, particularly from disadvantaged groups, and their smooth physical and mental growth will be inhibited. Children and their parents, particularly in rural areas, will be more vulnerable to various diseases and infections. Higher dropout rate will lead to wastage of resources and will negatively affect efficiency of education system. Overall health indicators among next generation will remain low. Social and economic disparities among different segments of the society will widen. Experts believe that investment on school health programs yield higher school returns in the areas of education, productivity of human resources, their health and environmental protection in a given country. By investing on school health program, Pakistan become overcome problems, deficiencies and implications. United Nations is committed to assist member states in the achievement of Millennium Development Goals, education for all, and other international norms and conventions aimed to improve quality of life of the people. On the occasion of World Education Forum is Dakar. In April 2000, four United Nations agencies WHO, UNICEF, UNESCO and World Bank signed a framework titled Focusing Resources for Effective Social Health Program to affirm their commitment for the school health programs. A number of United Nations agencies have been supporting different components of school health program. Although a holistic approach has been lacking, agencies contributing towards this program include WHO, WFP, UNFPA, UNESCO, UNODC and UNDP. School health program has been envisaged in the joint United Nations Programme on Health and Population. As is evident from its name, school health program requires collaborative work between two sectors, namely education and health. As it evident, a number of United Nations agencies have been supporting different components of school health program, although a holistic approach has been lacking. All these individual agency-based scattered interventions can be harmonized and interlinked to form a focused program of school health. This can be achieved with strong interest and leadership of Government of Pakistan and increased coordinations among United Nations agencies under one United Nation or delivering as one approach. An important component of school health program is health education. The curriculum wing Ministry of Education has contributed significantly towards the inclusion of health and hygiene education and environment related contents into school textbook. In collaboration with United Nations agencies like UNDP, UNESCO, UNFPA and UNICEF, special training manuals and supplementary reading material for teachers have been prepared and teacher training workshops organized on following themes, which include environmental education, population education, AIDS prevention education, life skill based education. All these interventions have remained limited in their scope and coverage due to financial constraints. Secondly, these interventions had not been institutionalized and their sustainability depends on support from donors. The National Education Policy 2009 provides for the following policy actions regarding school health program and related emerging trends. And you can see here on your laptops on the screen the policy action regarding school health programs and related emerging trends. Provision of National Education Policy under the section on curriculum reform are comprehensive. This provision shows commitment of the Government of Pakistan to include content on health-related issues like AIDS, prevention education, life skills-based education, human rights, population education, and other patients areas in the curriculum. School health education and school safety shall be infused within the curricula and learning materials with focus on improving school environment, enriching health education content, instituting regular mechanism for health screening and health services of students, and nutritional support to needy children in coordination with Department of Health, Environment and Population at the federal, provisional and district level. Policy action of the new action national education's policy clearly supports the regular mechanism for health services of school, including health screening and nutritional support to needy children in school. Now, since the new national education policy have been approved on 9 September, the federal and provisional government stand committed to implement policy actions. National Drinking Water Policy envisages to provide access to safe and sustainable water supply to entire population of Pakistan. Similarly, the National Sanitation Policy aims at providing adequate sanitation coverage for improving quality of life of people of Pakistan and provide physical environment necessary for health life. Both these policies support the provision of water and sanitation facilities to all, including in schools. Water and sanitation facilities contribute towards improving school health environment, which is an important component of school health program. Pakistan needs to take concrete steps for launching of a country programs of school health and then its institutionalize and sustainability. Types of strategic actions to be taken for implementation of school health programs in Pakistan are include legislation and policy reforms for provision of health and nutritional support to all the children in school, formation and formulation and enforcement of equitable standards of school facilities, resources mobilization for school health programs, coordination mechanism between health and education sector, institutional capacity development, advocacy and research in favor of increased attention to education and health of school children, sustainability mechanism to ensure that projects launched are consequently integrated into the regular system. There is an urgent need for advocacy and consultations with key officials in the Ministries of Education and Health for school health program in the country. Outcome of this consultation may be in the form of a clear national policy on school health program. Other actions at the federal level may include development of advocacy material on SHP, organization of orientation seminars for key officials and preparations of curriculum for training of teachers on this theme. Main actions should be considered include units on SHP, separates the units or sections on school health program may be established at the federal level in both relevant ministries, Ministries of Education and Ministry of Health. Advocacy. Policies dialogue with Ministry of Education, Ministry of Health and Environment including orientation of key officials on the concept and rationale of SHP. Decision makers should be convinced to invest on different components of school health programs. Material in development. Preparation and production of advocacy and teaching learning material on school health program for the officials, educators, school heads and teachers. Students' curricula integration of new and new explicit messages relating to human nutrition, HIV and AIDS prevention education and population education in the textbook for students. Inclusion of health education or school-based health-related activities and approaches in the teacher training curriculum. Studies on pertinent issues and indicators relating to the health status of school children and building a database. The patron at the federal level, provisional governments should also take policy actions and correct the steps for planning and launching of school health program. Mechanism for coordination between various actors of SHP may be instituted. Roles and responsibilities of various departments and officials at different levels may be spelled out along with allocation of necessary budget required for this program. Relevant focal persons, organizations at provisional level should also undertake the task of material development, training and research in this important area. Coordination mechanism include provinces should constitute steering committees or task forces for policy level work on school health program. These committees should include representatives from both health and education sector. Provisional departments of education and health should establish school health units to plan, implement and monitor interventions relating to school health program. Policy dialogue with provisional departments of education for launching of a pilot project of school health. Provisional governments should formulate and launch pilot projects either focusing on selected districts or few interventions for the whole province. Identifications, mapping and networking of the relevant provisional level institutes and organizations which can extend technical support. Roles and responsibilities of various departments and officials at different levels may be spelled out along with the allocation of necessary budget required for this program. Relevant focal point organization at provisional level should also undertake the task of material development, training, and research in this important area. District governments and public sector offices at district and sub-district level plays a pivotal role in the implementation of interventions relating to school health program. Few important actions include orientation. District education authorities, district level health staff, and district NAZIMs need to be provided orientation about the concept and rationale of school health programs, including roles and responsibilities of different departments. Periodical visits of medical doctors to the schools for undertaking following tasks, which includes annual or 6 monthly medical checkup of all students, particularly their eyesight, weight, and other indicators of fitness. Informative lectures on health, hygiene, and nutrition. Special lessons in secondary high schools on issues and disease related to the adolescents. Orientation of schools heads for organizing the school-based health and nutritional interventions and provision of necessary financial and administrative support to the school for this purpose. Organization of short courses for training of school teachers in methodologies for communication of key messages on health and population to the students in the classroom. Training may also cover the basic steps for health screening of students in the absence of medical staff. Provision of resources, medical material on population and health issues to the teachers and students. School level interventions. Possible interventions at the school level may include drug education, anti-smoking drive, deworming campaigns, food as incentive to enhance the enrollment and attendance, special food supplements, promotion of use of iodized salt, provision of water and sanitation, training of teachers to undertake the screening, health screening by teachers themselves in the absence of medical staff, training of teachers to undertake screening. Success of any future country-wide school health program will largely depends on two factors. Firstly, the will and determination of political leadership to invest on this important area, which will affect health and education of next generation in Pakistan. Secondly, interest and willingness of various stakeholder organizations at national and international levels to join hands to collectively plan and implement this unique program, which cannot be implemented by one ministry or department alone. International community, including donors, United Nations agencies, and professional institutions, to come forward to build a partnership for school health program.